The human body is a universe of fascinating complexity, capable of phenomena that sometimes defy conventional medical explanations. Today, we step outside the ordinary to explore the remarkable stories of 10 children born with extraordinary physical conditions. Their lives are not defined by limitations, but by a spirit of unwavering survival and a unique physical identity. Number 10, Gabgum, the dilemma of the fifth limb. Gabgum, a young boy from Nepal, was born with a partially formed third arm growing from his back. This appendage is considered the undeveloped remnants of his twin. The complexity of his case is compounded by its connection to a cleft in his spine, a malformation known as spina bifida. Although the arm is non-functional, surgical removal represents a high risk of nerve damage and permanent paralysis for Gab. As he grows, this fifth limb presents constant challenges related to comfort and mobility, forcing him to adapt to a unique anatomical reality. Number 9, Charlotte Garside, overcoming the prognosis of ultimate dwarfism. Charlotte Garside attracted worldwide attention as the world's smallest girl at birth, measuring barely 25 centimeters. Initially, doctors struggled to diagnose her condition, finally identifying it as an extremely rare and undetermined form of dwarfism. Her parents were advised that she might not survive beyond her first birthday. Defying this grim prognosis, Charlotte lived well past her 6th birthday, demonstrating incredible resilience. Her size requires dressing her in doll clothes, and although she faces developmental challenges, her life is a powerful testament to her victory against medical odds. Number 8, John Chris Carl Kante, the enormity of multiple hyperdontia. John Chris Carl Kante was born with multiple hyperdontia, an exceptionally rare condition causing the growth of more teeth than usual. Due to financial constraints, his condition remained untreated until he was in the 4th grade. During his first dental examination, doctors counted the staggering number of 300 teeth in his mouth. This excess significantly increased his risk of severe periodontal disease. John Chris has since undergone numerous surgeries to remove the supernumerary teeth and will require several more over the next few years to complete the delicate extraction process and allow for good gum healing. Number 7, Pan Xuan Hong, the dermatological burden of ichthyosis. Pan Xuan Hong earned the nickname Chinese Fish Boy due to the scales that cover his body from head to toe. This is the result of ichthyosis, a hereditary and currently incurable skin condition. The condition is intensely uncomfortable, causing constant itching and severely limiting his movements. Furthermore, the extreme thickness of the scales prevents his body from naturally regulating its temperature through perspiration. Pan relies on cold showers for temporary relief, navigating a difficult life defined by the persistent physical burden of this severe dermatological condition. Number 6, Tessa Evans, the pioneer of Arhinia and 3D printing. Tessa Evans was born with congenital Arhinia, a remarkably rare malformation characterized by the absence of a nose and a total loss of the sense of smell. To ensure vital oxygenation, she initially required a tracheotomy tube for breathing and tube feeding. However, Tessa was also a pioneer. She was the first patient to undergo a revolutionary procedure using a 3D printer to create a nasal implant. This cosmetic prosthesis will be periodically modified and replaced as she grows, compensating for the loss of her olfactory function. Number 5, Shiloh Pepin, the mermaid syndrome. Shiloh Pepin was born with cyrinomyelia, also known as mermaid syndrome, a lethal embryonic condition where her legs were fused into a single limb, mimicking a mermaid's tail. Surgical separation was deemed impossible by specialists due to the critical arteries and blood vessels crossing the fused limb. Her internal anatomy presented major survival challenges, as she was born without a large intestine, bladder, or uterus, surviving only with one partially functional kidney. Doctors initially issued a fatalistic prognosis, giving her only a few days to live. Against all odds, Shiloh demonstrated incredible determination, celebrating her 10th birthday. She underwent multiple complex operations and 2 vital kidney transplants before unfortunately succumbing to complications from pneumonia. Number 4. Eli Thompson, The Short Life of Ahinia. Born in 2015, Eli Thompson was diagnosed with the same condition as Tessa Evans, congenital Ahinia, the state of being born without an external nasal structure. His parents, Jeremy Finch and Brandy McCarthy, chose to show unconditional love by accepting their son's unique appearance and focusing on his immediate health needs, initially refusing any reconstructive surgery. Eli had to face complex challenges in learning to speak and feed naturally, requiring the immediate installation of a breathing tube, tracheotomy, right after his birth. Although his time was extremely brief, Eli was known for his warm spirit and joyful resilience, tragically passing away before he could celebrate his 2nd birthday. Number 3. Isla Summer Mucha, The Smile of Macrostomia. Isla Summer Mucha was born with bilateral macrostomia, a congenital anomaly where the sides of her mouth did not fully fuse at the corners during critical prenatal development stages. This results in a very unusual and visible facial feature, often described as a permanent smile, due to the spectacular widening of the oral opening, although the cosmetic appearance is the first thing that strikes you. This deformation has a severe and functional impact on her survival mechanisms, making crucial oral movements such as sucking, swallowing, and eating extremely difficult. The medical prognosis clearly indicates that Ayla will require early surgical intervention to correctly close the facial gaps and allow for the acquisition of the oral functions necessary for a normal life. Number 2, Madden, shared heterochromia and cleft lip. Madden was born with a combination of 2 distinct conditions, a cleft lip, keloschisis, and irides heterochromia, a genetic variation that gives him 2 distinctly different eye colors, typically one blue and one brown eye. Unfortunately, these visible physical differences made him vulnerable to bullying and harassment at school, a heavy psychological burden. However, Madden chose the path of resilience, refusing to let his unique physical identity define him negatively. His situation took a comforting and powerful turn when he found an unexpected companion, a rescue cat that remarkably shared both of his rare traits, a cleft lip and heterochromia. This instant and profound bond provided Madden with a unique source of emotional support, validation, and belonging. Number 2, Hukong, the masked boy and the transverse facial cleft. Hukong, a boy from southern China, was born with an extremely severe form of transverse facial cleft, a profound fetal malformation that creates large bilateral gaps extending from his mouth towards his ears. This spectacular and severe deformation earned him the poignant nickname Masked Boy within his community. His parents, local farmers, were initially devastated by the diagnosis, and the family faced painful social ostracism. Despite the severe cosmetic, swallowing, and functional challenges he must overcome, there is medical hope that his facial bones and soft tissues may eventually take a more regular shape as he matures, offering a glimmer of hope for future corrective procedures and social reintegration. Number 11, moment of unexpected cases. In the quiet room, a mother holds her newborn. Born with a rare condition, the baby draws the attention of the doctors. Machines monitor every moment. Despite the challenges ahead, hope remains, carried by love, care, and the strength of life. These 10 children remind us that strength is measured not only by physical form, but by the spirit they exude. Their complex medical realities underscore the vast, often mysterious potential of the human genome. They are not mere medical cases, but living examples of perseverance and singular beauty.